Welcome to my video guide on how to perform a thorough examination of the mouth. In this video, I'll provide you with a detailed and comprehensive guide that will help you examine the mouth of your patient more effectively and accurately. I'll cover both extraoral and intraoral examinations, oral hygiene, soft tissue periodontal conditions, and occlusion and caries diagnosis. Now, first, let's start with extraoral examination. While dental textbooks provide a very detailed approach to examining the mouth, we understand that routine clinical practice imposes more constraints that require a modified approach. So in a routine clinical practice, you can usually limit the extraoral examination to a visual appraisal of swelling, asymmetry, and the patient's color. However, more detailed examination can be carried out if indicated by the patient's symptoms. In addition, lymph nodes should be palpated. Now, let's move on to intraoral examination. Oral hygiene is an important factor in maintaining good dental health. I recommend using a validated plaque score to avoid subjective scores to motivate the patient with an objective measurement. So the entire oral mucosa should be carefully inspected for any abnormalities, and any ulcer that lasts more than 3 weeks requires further investigation. So the tongue, floor of the mouth, lips and oropharynx, tonsil crypt and tonsils and hard palate should be examined. Now, the periodontal condition is another important factor in dental health, so it can be assessed rapidly with a periodontal probe, charting the teeth present and examining each tooth for caries. And the integrity of any restorations present is crucial. Inclusion should involve not only getting the patient to close together and examining the relationship between the arches, but also look at the path of the closure of any obvious prematurities and displacement. Finally, check for evidence of tooth wear. So let's move on to soft tissue examination. Oral cancer is a major concern, and it's important to detect it as early as possible. The soft tissue examination should be thorough and should include the entire mucosa. Look for any suspicious areas, especially in smokers and heavy drinkers. Any lesions that have been present for more than 3 weeks should be biopsied. Then periodontal examination is also crucial for maintaining good dental health. So it involves examining the gums, teeth, and underlying bone structure. The exam should include an assessment of the depth of the gum pockets, bleeding on probing, mobility of teeth, and the presence of calculus or plaque. Periodontal examination is an essential aspect of intraoral examination and should be performed regularly to monitor the progression of periodontal disease. So the occlusal examination is also an important factor in diagnosing problems related to the bite and the jaw. So it involves examining the relationship between the upper and lower arches, the path closure, and the presence of any premature contact. A crucial examination is essential for diagnosing malocclusion, bruxism, which can lead to tooth wear, headaches, and jaw pain. So finally, let's discuss caries diagnosis. The examination should involve checking each tooth for caries and the integrity of any restoration present. So early diagnosis of caries is essential to prevent the progression of disease and to save the tooth. So caries can be detected using visual examination, tactile examination, and radiographic examination. Now, the first thing is visual examination. So visual examination involves using a dental mirror, a good lighting to visually inspect each tooth for any signs of decay such as discoloration, softening of the enamel, or cavities. Then there's tactile examination. So tactile examination involves using a dental explorer to feel the surface of each tooth for any soft or sticky spots, which may indicate presence of decay. Then we move on to radiographic examination, such as bite wing or periapical radiographs. And this can help detect caries that are not visible to the naked eye, or to confirm the diagnosis of a suspected caries. But it's important to note that caries can sometimes be asymptomatic, meaning that the patient may not experience any pain or discomfort, even if the decay has progressed. So this is why regular dental checkups are crucial, as a dentist can detect and treat caries in its early stages before it causes significant damage to the tooth. A thorough examination of the mouth is essential for maintaining good oral health and preventing dental problems. By following a systematic approach and conducting extraoral and intraoral examinations, dentists can ensure that they detect any pathology and provide the best possible care for the patient. Additionally, early diagnosis of caries is crucial to prevent the progression of disease and preserve the tooth. By following the guidelines outlined in the video, you can provide your patients with the best possible care and improve their oral health outcome. I encourage you to continue learning and improving your skills as a dental professional. Stay up to date with the latest research and advancements in dentistry to provide your patients with the most effective treatment. If you have any questions or comments, please feel free to leave them down below. Don't forget to subscribe to my channel for more educational videos like this. Thank you again for watching, and we'll see you in the next video.